Okay, with skin cancer, like any cancer, what we're dealing with is an abnormal, excessive growth of abnormal cells. Okay, so that's really what's happening again with skin cancer. This would be a site of skin cancer right here. Melanoma, is what it's called here. So we got we're going to go over all the different characteristics of skin cancer, but this would be a site of skin cancer on a patient, or potential skin cancer. Generally, it's due to excessive exposure to sun. So that's kind of what we're looking for with our patients, okay? And that's kind of what we're educating them on what it is. With our assessment, so the assessment with skin cancer, there are A, B, C, D, and E. So that's the best way, that's like kind of the mnemonic to remember skin cancer. For A, we're talking about asymmetry. The site should be asymmetrical versus like a mole or a freckle that's going to be much more symmetrical. Border, it should be an extending border, okay? The color should be abnormal. It shouldn't look like a mole or anything like that. It's going to look at an abnormal color. Diameter, it's going to be much larger than a mole. And then elevation, like this here, you can see this is elevated. Okay, so those are the A, B, C, D's, and E's of skin cancer. That's the best way to kind of remember what skin cancer is and how to identify it. So if you're doing your regular skin checks on your patient, and you notice this abnormal kind of looking mole or whatever, kind of apply your A, B, C, D's, and E's and determine, okay, is this just a mole or a birthmark or something like that, or is this something that needs to be investigated a little bit more closely, okay? So A, B, C, D's, and E's of skin cancer, all right? So what we're going to do with our patient, first thing we're going to do if we see this and we see something that looks suspicious to us, we need to do a biopsy to confirm diagnosis. So once that's confirmed, of course, there's chemotherapy and radiation to help kind of with cancer, but we need to instruct our patient on risk factors. We need to be talking to people about the importance of using sunscreen, avoiding peak times of UV rays in the late afternoon, and then wearing protective covering when appropriate, when working outside, wearing a hat, long sleeves, etc. And we need to educate our patient on how to monitor lesions. So if they come into the doctor, or we see them and we say, hey, that's probably nothing, but it looks like it could be suspicious lesion on your body. We need to teach them to monitor that and teach them the A, B, C, D, E's of skin cancer assessment, and make sure that they're assessing the border, so they're assessing the asymmetry, the diameter, and assessing any elevation. And that's kind of the best way that we can prepare our patients to be able to monitor it and report any changes in that, okay? So that's kind of what we need to be doing for our patients with skin cancer. Not a whole lot more here. This is kind of a brief lecture, but I just want to give you a quick overview of skin cancer.